At this time, I'd like to introduce the president of Northwestern Oklahoma State University, our own Janet Cunningham. And she's going to talk to us today about consideration and involvement with a reduction in the budget and other more positive aspects of our great university, I'm sure. Thank you, and let's introduce Dr. There's got to be some good news among all of this.
Surely. Well, not a very happy topic, but one that we've been dealing with for a while. And first, I'd say thank you for asking me to speak and not saying that I was a guest, since I am a member. So that's good. I'm going to ask. I'm going to take all the Northwestern connected people out of the deal. But what do you think the budget for Northwestern is? Anybody have an idea? This would just be, there are several budgets, but this would just be the education in general budget. Now, Richard, you probably have an idea too. That may be unfair. We have, and that doesn't include auxiliaries and grants and so on, but just our regular education in general budget. Any ideas?
15 million.
15 million, okay. Anybody?
8.8 million.
8.8.
19.2.
19.2. Okay, well. Actually, you're going in the right direction. The budget for this year, for the year we just started, is 25.8 million. So that gives you an indication. The state appropriation cut that we have taken coming into this year is 1.6 million. So that is a rather large amount. That's a little more than 16% of the state appropriation amount. And our total state appropriation for this year is 8.3 million now, which represents about 32.3% of the budget. And I think as I've talked to Kiwanis before, I've said, you know, when I started as the business officer back in 1990, the goal at that time was if we could just get students to pay a third of their cost of attendance, we have far exceeded that goal. So now the state picks up 32.3 and other items account for the rest of that. That 8.3 million really brings us back to about 04-05 state appropriation numbers. So I think our highest appropriation was in the right at 11 million. So the 1.6 is a big number going into this year, but really we've kind of seen some erosion since then. And that's not specifically just Northwestern, but that's all public, all 25 public institutions. Well, how did we balance the budget? Of course, as a CPA and somebody that had hands on the budget for many, many years, last June, a year ago, when we had our budget prepared for that particular time period, Dr. Paikey and I talked quite a bit about this budget is not going to hold. There's too many estimates that are probably unrealistic, and I'm not sure quite how we figured that out, because there's certainly lots of smart people out there, but we knew from almost the beginning, July 1 of 2015, that probably that budget there was going to be a problem. So we started even very early on in the budget year, evaluating positions. And, at an institution where you have 250 employees, you have turnover. I mean, that's just kind of a matter of life, retirements, and people moving on to other opportunities. As some of those came open, we evaluated very carefully, did we need to refill that? My opinion, my philosophy, I would lots rather see if we can do without it than to hire somebody new in and then have to tell them 6 months later, sorry, we're going to have to let you go. So that's what we did. And there were several that we did refill, and then of course several that we did not. But to balance the budget for this year, we will have 14 fewer positions than we had starting last year. 2 are faculty position. 1 was more of a program decision really than budget, just lack of majors. But the other one was one we just decided not to fill, and 12 staff, and they impact every facet of the institution. I mean, these are positions that have been held in the past. They were important positions, things like a service learning coordinator and a special events coordinator, and positions that were valuable, but when you kind of come back to the core mission of the institution, ones that we felt like we could do without. But all occurred through attrition. We didn't have to go to anyone and say, other than the 1 faculty position that was more of a program change, we didn't have to say, your contract is over at the end of the year because of budget. You've read newspaper accounts, I'm sure, or watched television news, listened to the radio. That has not been the case at several institutions across the state. I read an article this morning that Rogers, right now, their employees have been asked to take 1 furlough day a month, starting this new year. Southeastern has had several furlough days and significant layoffs, NEOA&M. I mean, you can kind of go through the list. So we feel very fortunate that we were able to plan ahead and keep from having to do that. So 14 positions. And then unfortunately, students and parents will be spending more, will be paying for more. We have a 9.8% increase in our tuition and mandatory fees. For us, it's all on the tuition side. And that equates to $19 per credit hour. So that's, when I was a student back in the 70s, I didn't even pay $19 an hour. I think it was $11.25 or something. So the increase is $19 per hour. Northwestern, however, is still very affordable, and if you look at total cost of attendance, tuition fees, room board, and books, it's around $12,000 a year. But the trend has been to increasing. Still, when you compare us to the other regional institutions, we're probably the lowest because of our room and board costs are still very affordable. And we're probably about in the middle on the tuition and fees. I think we're tied for 4th lowest of the 11 regional institutions. I think it comes down really to a philosophical question, and you see this kind of playing out not only in the state of Oklahoma, but a lot of different states, about the value of higher education. And there's, kind of the side of, well, it's just a private gain. Someone who attends, gets a degree, they're going to earn more money over their lifetime, and everybody agrees with that. That's a true statement. But there is a lot of public good from having people who are educated in your state. And I think for Oklahoma to really move forward, we're going to have to come to grips with the fact that we need more educated individuals. We're below the national average. I think we're at 24%. And the chancellor, Johnson, always gives this statistic, but degree attainment and per capita income track in the same direction, and no state with low degree attainment has a high per capita income. I mean, it's kind of they're just tied directly. Plus, there are just lots of other benefits. States with high degree attainment have more volunteerism. They have more people who give blood. I mean, you know, there's a whole list of things that go with having more of your citizens that are educated. So that's the budget. You know, when I presented to the board a couple of weeks ago, I said, okay, you know, I'm tired of whining about this. It doesn't really matter. I mean, it is what it is, and we'll move forward, and you know, we'll make the decisions that we have to, and go from there. So I'm going to leave you with some good things, and I usually come and talk to you in September, so we may repeat some of those, but just a few things that are going on. You may have noticed the banner on the corner of Highway 64 and 281. We sent 8 students to the College National Finals Rodeo. Came home with a national champion, J.D. Struckness, that's hard to say, from Minnesota, is one of our students and is a national champion in steer wrestling. He beat out his teammate, Jacob Edler from Iowa, who finished second by 1 second on 4 rounds. So the national champion was 18.4 seconds total, 4 rounds, and Jacob was 18.3 on 4 rounds. So we had them 1 and 2. That's fast. That is really fast, especially when you're diving off a galloping horse onto a steer. Our men's team, which really they were not one of the teams chosen to compete as a team, because they only take the top 2 in the region, and I think we were 3rd or 4th as a men's team. But actually, with only 4 competitors, a full team would have had 6, won the reserve champion. So we placed in, of course, 1st and 2nd in steer wrestling. We had, I think, the 4th place tie-down roper, and then we had a bareback bronc rider who placed. So they did very well. Our women were 2nd in the region, so they got to go as a team, but that's a 4-member team, and they finished in the top 20, but not quite as good as they wanted to. I think all of those girls are coming back, so they will be ready. On the men's team, JD will be back for 1 more year, the national champion. The other 2 were seniors. We had our first ever team compete in the Governor's Cup, which is a business plan competition that's been going on for quite a while. We just had never had a team that was interested in that, and we kind of pushed that with our business area. In fact, I told Dr. Palmer, we're going to have a team, so figure out how to get it done. And we did that, and Dr. Hawkins was the sponsor, or the person that was involved with the team. And our 2 young ladies made it to the finals for the first competition. And I thought it was ironic that these 2 young ladies were from California, kind of reverse Okie there, competing for Northwestern. Megan Hinchke, who actually originally came here to play volleyball, and Jessica Tejas, who originally came to play soccer, but was no longer playing soccer, but continued and finished up her education. And they actually, as finalists, they received $500 each from the Governor's Cup organization, which was sponsored by the Donald J. Reynolds Foundation, and now Love's Country Stores has taken over that sponsorship. And there's some pretty good prize money. I mean, the first place team, I think, wins $10,000, because what the plan is for them to take their business plan they've developed and try to turn it into a functioning business. So that's the intent of the prize money. You may have noticed some things going on at Coronado Hall. That hall has 51 suites, and those are 3-room suites, so you can house 6 students in 1 suite. All 51 of the suites, we have totally renovated the bathroom area, the common area, which means the showers, the toilets, the sinks, the cabinets, walls, flooring, and ceiling. So all 51 have been totally renovated. All the hallways, laundry rooms, stairwells, lounges on all floors have been done with new walls, flooring, and ceilings. And on the 4th floor, all the sleeping rooms have new HVAC, new movable furniture, new walls, floorings, and ceilings. All the other floors, the sleeping rooms have received the new HVAC and the new paint, but we didn't have enough to do the movable furniture. So on the 4th floor, we've taken out all that stationary furniture that was, Mark, you're picturing it in your mind, I can see. Mark knows exactly what we're talking about. And all of the HVAC systems. So, and we thought, well, if we're going to do a floor, we'll do the 4th one because they have to trudge up to that 4th floor, so it should be nicer, and it will be. We're also very excited about the new DMP program. You've heard about that. Funded totally by Share Trust and the Wisdom Family Foundation, approved this last January with the state regents. And we've just, here in about the last 3 weeks, have hired a new director for that program that will be on the job working on curriculum. We'll probably look at a faculty member in the 2nd semester, and then the first students will start that program fall of 2017, so a year from this fall. So we think that's going to be a very, very nice program that will be there for a long, long time. The other project we're working on this summer is the gymnasium. We were to the point in the gym, I know several of you have attended basketball games, our bleachers in the gym, you know, that some people still refer to the new bleachers, but they were put in 1985, so we got our money's worth out of those. They were to the point that you couldn't, it used to be they had a motor and you moved them in and out with a motor. Well, that had long gone away, and so we would have to get like 15 people to come over and pull out on one side or one end, and then another 15 to put them back in. And now that we have volleyball, that gym has to be turned several times, in the course of a week with practices and games and so on. The floor, the last time we had put in a brand new floor, I think, was back when we had a windstorm tornado that blew part of the roof off, and we replaced the floor at that time. We were down to the point where we couldn't sand it anymore. They come in and they sand that floor and re-seal it every year. And we were kind of to the point where there wasn't much left, and so we're putting in a new floor and just doing some general upkeep, painting and that type of thing. So I think you'll be pleasantly surprised when you attend an event up there. Right now, if you walk into the gym, there are no bleachers. The floor is gone. What you see on the floor are just kind of planks. Not even the plywood has been put down yet. We have about 300 coming in for a student council camp Sunday for the week, and they will use the gym, which is fine. They'll be able to use that. In fact, they'll have way more space than they've ever had, and then as soon as they're out, then we'll come back in and start on the floor. The expected date of the seating is about the middle of September. So we worked some arrangements with the rec park if volleyball needs to practice there. We're also using the little gym that we have for that. So, any questions?
In the gym, is the seating arrangement changed, and what's the capacity?
We will lose a few, quote unquote, a few seats. I mean, there's always debatable about what the seating capacity is. I think we will have the same number of chairbacks that we've had, and they will be in the same configuration. We will have scoring tables on both sides. You know, we all used to just have them on the the west side, and now there'll be a place on the east side too, because there's just, everybody's bringing more media with them and so on, so we're preparing for that. I think the seating capacity will be down, but probably less than 100, maybe around 50 as I recall. So, yes. Whoever, Garden.
Go ahead, Ida. I'll remember.
Ida.
I'll remember what I was.
Okay, Ida.
What about the renovations in front of the library?
We have, you will notice that the fountain is not there. I had a visitor, what was it? Was it last Saturday? Yes, I think Rick and I had just come back into town from somewhere, and a lady was kind of walking toward the president's house, so I thought, well, I'm just going to wait because I know she's coming. And she said, where is the fountain? She had gone to school and graduated back in the 70s and had not, is from Chicago, had not been back. And I said, well, you can see it's no longer there. It was no longer working. We could not resurrect it. It had just become an eyesore. We've got a beautiful plan that John would love to show anybody who wants to see it of what we'd like to do in the mall area. But right now the funds are just not there. We're going to have to raise private money to be able to do that.
What did the acronym for the new program sponsored by Share Trust and Wisdom Family Foundation stand for?
Doctor of Nursing Practice, DNP. And you'll hear people in healthcare talk about, you know, we have 3 DNPs and 2 PAs, and it's just a Doctor of Nursing Practice. So, yes.
Any prospects on the men's basketball coach?
I actually met with one this morning before I came here. Brad Franz, of course, as you all know, it has been named the athletic director, and he has more contacts in the basketball world than just about anybody I know, and so we have a person that's come in today, and he and I are going to meet this afternoon and kind of evaluate that position. Dr. Hannaford is over in his new office. You know, Dr. Lohman, I texted him first thing Tuesday morning and said happy retirement, because this is the first day you'll know it. That you didn't have to, and he texted right back, yeah, he's enjoying his first cup of coffee. So, and Dr. Hannaford's position is one of the positions we have not filled, we won't be filling. So we've done a little reorganizing in the academic area. Dr. James Bell, we used to have Dean of Arts and Science, Dean of Professional Studies. Dr. Bell is now an Associate Vice President and Dean of the Faculty. He will still have all of the arts and science, and also taking over like assessment and some different things. And we're going to see how that will work for us. I told Dr. Hannaford I hate for him to start with one hand tied behind his back, but that's where we're at this point.
I know enrollment's down a little bit. Do you think it has anything to do with the increased tuition fees?
You know, we've tried to evaluate, and a lot of presidents, you know, we have that discussion all the time. You know, if it were only cost, you know, OU and OSU would be seeing downtrends. I mean, and they're not, because they're double what the cost of undergraduate is at Northwestern and East Central and Southwestern. We tried to evaluate, I think some of it is kind of just a carryover from the oil and gas boom. You know, we lost a lot of students that were even juniors and even maybe 15 hours left. And we've got an initiative going on right now. We've identified a number of students with 85 hours that didn't graduate that we're contacting back, and we've had some pretty good response from that. Our freshman class is trending up. We were down on freshmen last year, so that's a good sign for us. So we're pretty excited about that. So I don't know if you figure out the secret of that. Let me know.
I was just talking to my son-in-law who does that kind of job at Stillwater. He mentioned that they focus largely on freshmen only as far as retention and increasing their enrollment through just freshmen only. Not so much retention as the upperclassmen. So,
well, we're trying to, do both.
Yeah.
But, and it's kind of funny, we have the young people who, sometimes the ones from close in this area, small towns, will come to Northwestern for a year or two, or any, this happens all over the state. And they'll just say, gosh, I've lived in a small town all my life. I want to go, to someplace bigger. We'll have the kids come from Houston or Dallas, and it's, almost the opposite. I like it here. I'm safe. Not a lot of distractions. If you can figure out 18 to 22-year-olds, you're doing better than I will do.
What are your most popular majors now? Which schools have the most?
I would say business, ag, nursing, and education. Psychology's up there pretty well, but business, business is such a good generalist type of degree, for anyone who wants to work for a business or wants to start their own business. So that's still a very popular program. Our nursing program has just done, really, really well. And those, we have a lot more quote-unquote nursing majors than we can accept into actually the junior, senior year. And we've tried to decide, on those students that want to be nursing majors but don't make the cut, and that's basically what it is, where we can redirect. Social work picks up quite a few. It's kind of a mentality of wanting to help people, and so looking for some ways. But ag continues to do extremely well. Dean Scarborough would be a great program to talk about. So many of their majors have jobs before they ever, get to the point of their graduation, because we have a long history with a lot of ag companies that want them very much. So,
what are the limitations of your being able to do the junior and senior nursing students?
Faculty.
It's
Faculty and clinical space. Hospital space, because nursing program is a tremendous number of clinical hours, especially in that junior year. And we run them in Woodward, we run a little bit here. Our hospital's just not quite large enough to get the broad spectrum of different things that they need to see. Of course, Enid, we do a lot. They do some clinical work in Oklahoma City, but every nursing program in the state is vying for a lot of the same clinical space. Ponca City, now we do some in Ponca City. So if you're a nursing major, you're going to drive to get to all those clinical sites. And then the community health, they have to do a lot of different pieces of that emergency room, obstetrics, you can imagine. And a lot of the small hospitals just don't have that broad range to be able to do it there. And faculty, we have now, let's see, 3, 4 faculty members. The nursing accrediting agencies have said now if you're going to have a BSN program that they want doctorally prepared teaching faculty, and we now have over half of ours with their doctoral degrees, which a lot of schools have struggled with. I'm going to give kudos to our nursing faculty. They've been willing to get that training. We've had a lot of schools contact us about our DMP program, as we see about getting some of their faculty in the program so they can get that doctorate. Anything else? Okay. Well, very good. So things, life will go on. I mean, the budget is not a great situation, but, it's just a little bit like your pocketbook at home. You'll make it work and decide the things you need to keep working with. So, thank you.